everyone. I hope I'm doing this correctly. This is Julee Goodman. I'm the school nurse at Rowlett Middle Academy. And I just wanted to take some time and talk a little bit about COVID-19 and the clinic expectations and things we're going to be putting in place this year to keep our campus safe and our students safe and healthy. I do have a PowerPoint to guide us along, but I did want to let you know we will also be sending home a COVID packet that will have some information in it, some parent expectations, a daily symptom checklist to have handy, maybe to put on a refrigerator or a cabinet. It'll also have some information that'll be helpful for just coming back to school after COVID-19, and just 10 tips for getting ready for school. So if you have any questions after this PowerPoint, please just give me a call, send me an email, and reach out, because we are back to work and we're getting ready and we'll be ready for your kiddos. So let me try to get this ready here. Okay, I think the most important thing we can all do as we open schools and get ready for your children to come back to campus is for parents, including myself, to stay up to date on this virus and become familiar with the symptoms and precautions, and screen ourselves and our children every single day before leaving the house. Again, we'll be sending home a guide from the CDC that will help just as a reminder. And it's just imperative that we do not send our kids to school ill. If you determine that your child has any symptoms, please let the school know and go ahead and give their doctor a call as well. So a little bit about the coronavirus. This is considered a novel coronavirus. It's a family of viruses that cause respiratory infections. When a new coronavirus emerges, it's referred to as a novel coronavirus, meaning new. The virus that causes COVID-19 is a novel coronavirus that began infecting humans in 2019. Health experts are concerned when a novel coronavirus emerges because they are unpredictable and people have no immunity to them. We're still learning about this coronavirus, but there are some things that we do know. For example, how does it spread? So this coronavirus spreads similarly to the way the flu and colds are spread, through droplets when we talk, sneeze, cough, sing, and shout. People can become infected when these droplets enter their eyes, nose, or mouth. Touching contaminated objects puts the droplets on your hand, and if you touch your face, the droplets can enter through the nose, mouth, and even your eyes. Signs and symptoms of COVID-19 are in a very wide range. We'd like for you to watch for these symptoms. These could be mild symptoms to severe illness, and a lot of people don't have any symptoms at all. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills, cough, and by cough, the CDC is describing this cough as a new cough and a consistent cough, and a cough that really causes us to have some difficulty breathing. So any cough that's different from baseline. Fatigue, muscle or body aches, a headache, but more specifically, a new or severe headache, a new loss of taste or smell that's sudden, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So how can I prevent getting the coronavirus? We're asking everyone to wash your hands often, either with soap and water for 20 seconds or using a hand sanitizer that contains at least 60% alcohol. Avoiding close contact with people who are sick, staying at home as much as possible, putting distance between yourself and other people, at least 6 feet, wearing a face mask with or without a face shield when around others. Cover your cough or sneeze with a tissue, and then of course throwing the tissue in the trash and washing your hands, or also covering your cough or sneeze with your elbow, in the bend of your elbow. Cleaning and disinfecting frequently touched objects and surfaces daily. All of these will be taking place on our campus this year. Please discuss with your child the importance of wearing a face mask and how to put one on and take one off safely, and also just how to wear. They should know that wearing a mask protects others. My mask protects you, and your mask protects me. We want to make sure the mask covers our nose and mouth. And then really wearing it correctly, that's where we're going to get the maximum protection. So we don't want to put the mask around our neck or up on our forehead or hanging it from our ear. Also, we don't want to touch the front of the mask. If you do, we need to make sure you wash your hands or use hand sanitizer to disinfect. The outside of that mask is considered contaminated. So you can imagine if you're pulling your mask down and it's resting against your neck, the inside of that mask is becoming contaminated. And same if you put it up on your head. The inside of the mask is considered contaminated. So we need to make sure that we are all wearing our mask appropriately. The cloth face mask while at school, we will be instructing the students to wash their hands before putting the mask on, making sure it covers their nose and mouth, and that it's really secured under the chin. We want it to fit snugly against the sides of their face and make sure they can breathe easily. The CDC does not recommend the use of masks or cloth masks for source control. If they have that exhalation valve or vent, that is really allowing you to exhale easier so you can breathe easier, but you're also exhaling potentially infectious particles. More do's and don'ts. You can see our friends here are having fun with their masks, and then they finally get it right. We don't want to see the mask on the head, or only around the mouth and not the nose, or hanging from the ears. So how to put on a face mask and take one off. We want to make sure we perform good hand hygiene before touching the mask, and we want to take a look at it and inspect it and make sure it's not damaged or dirty. When we put it on, we want to loop it around our ears and make sure it covers our mouth, nose, and chin. And hopefully there won't be any gaps on the sides. We'll reinforce not touching the mask, the outside of the masks, and we want to clean our hands before removing it. When it's time to take it off, we're going to remove the mask by grabbing the straps behind the ears or the head and pulling the mask away from our face. And then we're going to store the mask in a clean, you can store it in a plastic resealable bag or a paper bag if it's not dirty or wet, and if you plan to reuse it. Here at Rowlett, we are going to be providing some pouches that will be attached to their lanyards. When removing the mask from whether it's in a bag or the pouch, we want to remove it by the straps when we take it out. And at that point, we're either going to reapply it to our face, or we're going to be home at that time and throw it in the washer or wash it by hand. And hopefully this will be happening at least once a day. Always clean your hands after removing the mask, before you put it on and when you take it off. How to wash the cloth face mask covering. There are some guidelines on the CDC website that you can include your mask with regular laundry, using regular laundry detergent, and the warmest appropriate water setting for that type of cloth that the mask is made out of. You can also wash it by hand. Just make sure it's completely dry before you put it on again. If you can, use the highest heat setting and leave it in the dryer until it's completely dry. So now we're going to talk about hand washing. Who knew there were so many steps to washing our hands effectively? So please, if you could discuss with your child the importance of hand washing, it is one of the easiest and most effective ways to prevent the spread of this coronavirus. But the germ-killing powers of hand washing only work if we do it correctly. So the proper technique is washing all surfaces for at least 20 seconds, about as long as singing the happy birthday song twice. So if we start with some soap and water, we want to rub our hands together, as you can see in this picture in step 1. Step 2, we want to rub the backs of both hands. Step 3, we want to interface our fingers and rub our hands together. That's getting the sides of the fingers. Step 4, we want to interlock our fingers and rub the back of the fingers of both hands. And then step 5, we want to rub our thumbs in a rotating manner, followed by the area between the index finger and the thumb on both hands. Step 6, we want to rub our fingertips on the palms of both hands. That gets our fingernails. And then step 7, we want to rub both wrists in a rotating manner, and we want to rinse and dry thoroughly. Most of us are used to using that paper towel on the door handle to exit whatever room we might be in. At RMA, we will be asking parents to screen your child at home before they leave for school. We will also be doing a temperature screening upon arrival to school at this time. We will have trained staff wearing the appropriate PPE, which is personal protective equipment, and that will include a mask, a face shield, and gloves when they're conducting temperature checks, and they will be using a non-contact thermometer. Students will be checked in our car rider loop, and our walkers and students exiting the bus will also be checked. Any student that has a fever will be sent to the clinic and wait in the isolation area for their parents to pick them up. And please, per our policy, we are stressing the importance of picking up your sick child within 30 minutes due to the risk of exposure to others. Regarding the clinic, there will be some new procedures put in place this year due to COVID-19 precautions. So our goal is to reduce the number of student clinic visits for non-urgent issues, and really just to reduce the movement on campus in general. The clinic will be reserved for potentially infectious, urgent, or emergent situations, as well as medication management. If a student needs a nursing assessment, the teacher will just call the clinic first for triaging. So the nurse will always be available. It's just going to be, the protocols and procedures will just be slightly different. And this is all for the safety of our students and staff. You can see how important it is to keep your child home if they are ill. Please do not send your child to school if they have received Motrin or Tylenol for illness. So Rowlett Middle Academy will have a COVID-19 response, and this will be per the Manatee County Health Department. Again, parents and guardians are asked to monitor their child for signs of illness every morning, and students who are sick should not attend school. Students are not required to get a COVID-19 test. There are many scenarios that we have been discussing for many weeks, and I'm sure you have had these scenarios go through your mind. I thought that I would present these scenarios in a question and answer type way on these slides. And then of course, if you would like to talk about them further, please just give me a call. It was kind of a challenge to really write everything out. But I think that we included most scenarios that could possibly present. So the first question is, how long does my student need to stay home if they tested positive or a doctor said they're likely to have COVID-19? So if your student has symptoms, they should stay home and away from others as much as possible until all three of the following have been met. At least 10 days have passed since their symptoms started, and they haven't had a fever in at least 24 hours without using any medication to lower their fever, and symptoms have improved. So as long as these three conditions have been met, they are considered safe to return to school. What if my student tested positive for COVID-19 but doesn't show symptoms? So if this is the case, your child should stay home for 10 days after the day they were tested and keep away from others as much as possible. This is because even if they don't have symptoms, they can still spread the virus. What if my student becomes sick but isn't tested for COVID-19? So they should still stay home in isolation until they are feeling better, and all of the following have happened. So it's the same criteria. At least 10 days have passed since their symptoms started, and they haven't had a fever in at least 24 hours without using any medication to lower the fever, and symptoms have improved. So what if my student becomes sick but tests negative for COVID-19? So they should stay home until they are feeling better and they have not had a fever for 24 hours without using medication to reduce the fever. If they do visit the doctor, which we do recommend, and the doctor tells your child that they have something other than COVID-19, like the flu or strep or hand, foot, and mouth, then your child should follow the doctor's guidelines for exclusion requirements for that disease. We will require a note from the doctor stating what the diagnosis is, or the note that states that they've had a negative COVID-19 test. So those test results will be required. What is a close contact? So there's casual contact, and then there's close contact. The casual contact would be just passing someone in the grocery store. You'd be at low risk for spreading COVID-19 if you're just walking by somebody. Close contact is when you're really close to someone, less than 6 feet, for at least 15 minutes. That would be considered close contact. Or if you're sharing a drink or eating utensil, or physically touching the person, or things that may have their germs on them, like dirty tissues, or being coughed on or sneezed on. That would be considered close contact. So what if my student came in close contact with someone who has COVID-19? If that's the case, they should stay home for 14 days since the last time they were around the person to see if they develop symptoms. If they do get symptoms, then we're going to ask that you call their doctor and recommend that they get tested and follow their instructions for staying home while you wait for the test results. It's very important that if your child is awaiting test results, that they stay home until those results are completed. What if I live with someone who has COVID-19? So people who live together usually have close contact with each other. Everyone you live with should stay home until all of the following have happened. And guess what? The sick person has to get better. And that means at least 10 days have passed since their symptoms started, and they haven't had a fever in at least 24 hours without using fever-reducing medication, and their symptoms have improved. Once this happens, then we need to add on the 14 days for you to quarantine. So it is possible that your child may be out for 24 days if you have someone at home, a parent or another sibling with COVID-19. So we still need to do the 14 days, make sure 14 days has passed since the sick person was better to see if other people in your home get symptoms. What if my student that had close contact with someone with COVID-19 and gets sick but isn't tested for COVID-19? So your student should stay home and away from others as much as possible until they get better and all the following have happened. At least 10 days have passed since their symptoms started. They haven't had a fever in at least 24 hours without using any fever-reducing medicine, and their symptoms improve. So what is the procedure for a positive case in the school? We will be working closely in coordination with the health department, the Manatee County Health Department. And the plan would be that the health department will notify Rowlett of a positive case. We are also asking parents and guardians to notify us as well if they receive a positive result. RMA will be working very closely with the epidemiologist, Dr. Ravi Gurbani, and Carol Peters, who's the nurse there. Her title is Interim Community Health Nursing Director at the health department. So working with them, we will be able to determine who may have had close contact. Families will be notified by the health department if their child was potentially exposed. Also, RMA will notify parents via Blooms if we determine that their child has potentially been exposed. And this would mean that your child was close to someone, possibly in their classroom or on their bus, someone that has COVID-19. The positive case would have happened in your child's classroom or classrooms or on their bus. RMA will also notify all families if we have a positive case on campus via Blooms. So there will not be any names or other identifying information disclosed, as that would violate privacy laws. I will show you a sample of these letters that you can look at. That way, if you do receive one, you already know the content of the letters, and we just didn't want you to feel alarmed if you get one, that this is something that we're going to be sending to everyone, whether we have a positive case or if your child may be considered to have had close contact with someone. So the health department will determine the need for potential closure and the duration. This could be a classroom or classrooms or a building or the whole school. Siblings of an exposed student do not need to quarantine unless the exposed student develops symptoms or receives a positive test result. So the letters I was referring to, if we have a positive case at our school, all families will receive this letter to let them know that we have learned of a confirmed COVID-19 case on our campus or on one of our buses. And again, we cannot provide any further identifying information because it will violate HIPAA laws. But we will be working with the local health department to reach out to families as well as faculty and staff who may have come in contact with this individual. The other letter that we have will be going to parents if their child had possible exposure to COVID-19. So if we learn of a confirmed positive COVID-19 case in one of your child's classrooms or on their bus, we won't be able to provide any further identifying information. Again, it would violate HIPAA laws, but we'll be working closely with the health department. There is information procedure to follow if your child is considered a close contact and exposed to the virus, and they will have to quarantine for 14 days. Please remember, not everyone develops symptoms when infected with COVID-19, but they are still contagious and may spread it to others. If your child becomes ill during this period of quarantine, we are asking that you call their doctor for guidance. And also know that a negative COVID-19 test does not alter this quarantine period. You will still have to have your child quarantined for 14 days. Regarding medications, if your child does need to have medication at school, please let me know so we can schedule a time for drop-off. We will be doing it by appointment only. Please do not arrive to the school to drop off medications without an appointment. If your child does have emergency medications, we are encouraging you to ask their doctor to approve a self-carry order so that they can carry their medications. This, again, is only for emergency medications like an EpiPen, inhaler, pancreatic enzymes, or any diabetic medications. And this is not new information here. We cannot accept any medications without a completed medication authorization form from your child's doctor. And this form can be found on our website under clinic information. So just a few final points. Hopefully you all, including myself, have been preparing your children for this year that's going to look different to them. Preparing them to wear their masks. It does require some practice. And please don't send your kids to school if they are sick. Make sure they know school is going to look a little different, and there's going to be some new safety rules that they'll have to follow. But following these rules will really help keep everyone safe and healthy. Talk to them about the 3 W's: washing their hands, wearing a mask, and watching their distance. The 3 most important things we have right now to prevent exposure to COVID-19. In addition to talking to your children about these public health mitigations, model them, because our actions will speak volumes and our children are watching. But also tell them we are really smiling under our masks. We look forward to seeing you and your children on campus. Please call me if you have any questions. And we are back at school now, so if you do have any medications that you'd like to drop off, we can schedule a time for this week, okay? Thank you, everybody. Stay safe.